Breast cancer is the leading cause of death among women in the United States ages 40 to 59 years old. Despite the risk, in 2009, the U.S. Preventative Service Task Force changed its recommendations for mammograms to only be performed once every 2 years for women between the ages of 40 and 50. However, Nancy Lee, who is Montana Komen's Foundation director, decided that wasn't enough, so she became a self-referral client for this year's mammogram.
We're going to do 2 views of each breast, and we're going to put your breast on this platform, and we'll be compressing it.
At my age, I believe every year is what we need. Why wait one additional year? Why take the risk of a cancer growing for a year?
While self-referrals aren't ideal from a hospital standpoint, they are still accepted.
Yeah, it really is better to have a doctor referral. Then your results go to a doctor. The doctor can advise you on your follow-up, tell you what you need to be doing, if a second callback needs to happen.
The latest statistics show that more than 50% of women with insurance are not getting annual mammograms. That's why the Komen Foundation is promoting the concept of less talk, more action. So after watching Nancy go through the process, I realized the importance of early detection, so I decided to get a mammogram too. Besides mammograms, self-exams, and knowing your family history, the advances of treatment and research into breast cancer have allowed the survival rate to jump to 98% if found early.
But early detection is so important because breast cancers can be caught as small as 4 to 8 millimeters. That is so tiny and so curable these days.
But in the United States, 95% of all breast cancers occur in women over 40. So as they get older, the risk increases, so it's more important to do your annual mammogram.
Sometimes there are follow-up tests, but usually they are only to reassure the doctor and patient what the first test showed.
Probably, and I don't know the exact statistics, 85 to 90% are fine.
And of those that aren't, thanks to early detection and modern technology, many can avoid serious treatment.
Some of those patients, if caught early enough, don't have to go and undergo chemotherapy now these days.
From Helena, Melissa Anderson for Montana's news station.